Without international doctors, the healthcare system here will not be very stable. And that's why they hired Robin Crook to do those reports, because they need doctors. They need internationally qualified healthcare practitioners in Australia. Now, I want to ask you this question. What do you think the chances are going to look like in the next 10 to 20 years? Are they going to need more doctors or are they going to need less doctors? Make a guess. Less doctors or more doctors? So why less doctors and why more doctors? If it's less, why less? If it's more, why more? What's the reason for those things? You need to be very clear. Okay? So Tin says less, Helen says less. There's a few coming in with more. More, somebody said there's AI involved. YouTube says less. So what are you going to do? Where are you going to get the right information from? So let me tell you. The truth is, okay, based on this study here, I want to just show you. Okay, if you can see this on the screen. Based on this study that is conducted by the Australian government, Department of Health and Aged Care, this is the projected supply versus demand for general practitioner, full-time employee. They predict that there's going to be an unmet demand, massive unmet demand by the year 2048. Can you see this? In the year 2048, this curve, the dark one, is going to be the demand. This is where the supply is predicted. Okay, we are doing around here, 2026. It is forecasted that the Australian population is going to increase because of various reasons. There's immigration inward into the country. Obviously, the population within the country is also going to increase. And the other thing is healthcare is going to be more and more required. And the other reason is that people are living longer. When I was in Base Coast Health Hospital as a medical registrar, I had a patient who was walking and he was 101 years old. You're going to see more of them. So that's why those predictions are coming in. All right. So yes, the opportunity is going to be good. You need to be absolutely clear about this. AI is going to be present, but nobody is going to take advice from an AI and put their life on it. I can assure you that, at least not in the next 50 years, until we have data and statistics of how artificial intelligence impact humanity in a better way. But right now, people want human advice. If someone is having cancer, they don't want the robots to tell them that everything is going to be okay. Yeah, I don't think you want that too. All right, so don't be too concerned. The answer is more demand. Okay, so you can see here, this is a clear curve here. So next, I want to talk to you about this. What is the cost? Okay, what is it going to cost you to make the migration journey in Australia? Do you have any idea? Okay, there's going to be costs here. You're going to have to spend your time. Obviously, it's going to take a lot of time. Somebody said time and money. Absolutely right. Time and money. And what is the other cost to you? There's another cost. There's one more. You need to be very clear about this. The other one is identity. Okay, when you come into Australia, sometimes you need to go back down. You know, you might be a practicing specialist. All right, there was one of the surveys and one of the publications I read.